Good afternoon. I'm Alan Vanderill, CEO at Smith County Memorial Hospital, and with me this afternoon is Christine Fowler, our infection prevention nurse, infection preventionist as we kindly refer to her. And last week when we did our discussion about safety and infection prevention at the hospital, we talked about how we wanted the public to feel confident that it is safe to come to both the hospital and the clinic to receive care, that we don't want anybody to be deterred from receiving necessary care or preventive care because they're afraid that there's COVID here and it's not going to be safe for them to come. So I thought what we would do this afternoon is spend just a couple of minutes talking about the normal procedures that we go through to disinfect our patient care areas after they're used for patients, whether the patient has COVID or not. And so that's why I wanted Christine to be here to talk through our infection prevention policies. So Christine, let me just kind of turn this over to you, but let me just ask you, one of the things we have emphasized throughout this is that we are not concerned about just being safe from COVID. We're concerned about being safe from any infectious disease. So talk to us about how our cleaning crew makes sure that they have a patient care space adequately cleaned after it's been used.
So we have had policies and procedures in place even prior to COVID for all of the illnesses and bacteria that exist in this world. So our environmental services staff goes by a routine of cleaning with disinfectants and making sure that that room is completely clean, which we would call a terminally clean room, both in the hospital and at the clinic. And I just want to emphasize that even before COVID, the same disinfectants were being used, and even now, we continue to use the practices to make sure that you and your family stay safe.
So the EPA characterizes disinfecting solutions, wipes, whatever, the substances that we use to disinfect rooms and equipment with. They have listed some specific items that are especially good for cleaning rooms or equipment where we believe there may have been a patient with COVID. What have we done to integrate those into our cleaning processes?
So including disinfectants that will destroy bacteria and viruses, we have implemented UV light. We use a device called the moonbeam. So after a room is completely disinfected by hand by environmental services, we initiate this light, which is similar to sunlight, so that we can continue to destroy anything that may be left after the disinfection process. It's kind of an added assurance that the room will be completely clean and gives us a little more control as far as environmental services does a wonderful job, and then this light takes care of anything that might be existing or left behind.
So this is new technology. This is sort of cutting edge stuff that has become more widely available, particularly as a result of this COVID pandemic that we're dealing with. And because of funding that we received from the federal government, we have been able to purchase these devices and train our staff to use them and implement them into our everyday procedures. So in summary, what we're trying to make sure that everybody understands is that every day of the year, every year, our environmental services staff goes the extra mile to make sure that the environment here, the rooms that we use, the equipment that we use, and so forth, are appropriately cleaned to get away from any transmission of disease from contact with those surfaces or that equipment. In the time of COVID, when we have to be even more careful, we've now implemented additional safety precautions, additional cleaning and disinfection procedures to make sure that we absolutely are certain that we're not transmitting the disease within the facility. So we hope that what this does is helps you feel confident that Smith County Memorial Hospital is a safe place to come and receive your care, whether it's in the emergency room, whether it's in the outpatient areas, the outpatient specialty clinic, or in our Smith County Family Practice. All of those areas are appropriately and adequately cleaned by our environmental services staff, and we hope to see you all here soon when you need care. Thank you.